and it's very beautiful to share with you this presentation. So, let me show you today, we're going to be talking about empowering your practice using Smarty. Smarty, different solutions, the different tools that we have to treat our patients with success. So, okay, the first tool, let me present by myself. I am Dr. Vicente Torres, I am from Spain. I started my degree in 1997 in Madrid, in Spain. So I studied my postgraduate program, and I was a professor associator at the University of Valencia, and in the same university I have my PhD. I was professor in University of Europea of Valencia, and for the last year in Internal have called doctor for national and international students. In all my career, I treated more than 10,000 cases for orthodontic and orthopedic cases. So, in this 20 years, I treated more than 2,500 cases only with invisible aligners. Since 2019, I'm in the top category from Invisalign, this diamond category. I think all the rest of you start to use Invisalign. Invisalign now is the most famous brand, was the first. So with Invisalign, we treat around maybe 1,700 cases only with Invisalign for more than 12 years. But no, it's the only brand. Because, I have more cases. In fact, the last 3 years, I am in Europe in the Diamond Apex category. It's the maximum category in Invisalign. It's only the 1% of the doctors in Europe who treat most cases with this brand. So, but it's the only brand we use. In 2019, Spark arrived to not to Europe, arrived to the world, because Spark is a new brand. It's famous too. It's a new brand because they started in 2019. In fact, this picture is in November of 2019. It's the first worldwide certification for Spark with doctors Diego Pedro and Iván Malagón. So with Spark, I treated around 350 cases. So it's not only I treated with angel aligner. With angel aligner, I was the first doctor to arrive for 100 cases treated in Spain. I have around 180 cases. And with Smarty, I have around 320 cases. So now I treat all my cases with a Smarty. After I explain you why I changed all my protocols, all my office to my cases to a Smarty. And this is for me is a special award in 2020 in the Europe, Middle East and Africa, and Imperial Award in the International Gallery for Invisalign. I have the third award with the best cases in International Gallery from Invisalign. Well, what's about the Smarty? I know some of you are using now Smarty, maybe any doctors don't know about brand. Today, I want to show you which make different Smarty with the other brands. The first that we need to know is who is the Smarty. to the micro?
Yeah.
Yeah?
Good.
So, like sometimes, Smarty, for example, in Spain, for example, is the third biggest market in the world in clear lines. It's maybe United States, China, and the third one is Spain. So in Spain, when I speak with colleagues, sometimes they go, oh, Smarty is a new brand. Smarty is not a new brand. Smarty maybe is the second or the third oldest brand in the world. Smarty started in 2004, the company foundation, by Mr. Jerry Ruffen, which is engineering, formed in UK. It's coming back to China, and they started to make the company in 2004, and in 2010 have the best two plants, two factories in Shanghai, in Xinjiang, and it was the first company in China to impress the 3D and the global in the tissue. So between here, we have in 2015, Cabo Group, we had a strategic shareholder. In 2017, they start with the technology. The first solution is S1 to S4. So like this, they started with a lot of different solutions. So it's around, they have 21 years from history, 21 years. So this is history and experience. And yeah.
The video is off. Yeah. Can you turn it on, the video?
This is my video. This is my video. And share the presentation. And see. Can you start again?
Yeah, maybe I will try again.
Okay. Now?
So they were saying that you need to turn the camera on because they want to see the screen.
Yes, they cannot see the screen. So once you turn on the video, they cannot see, they can see the screen. So we need to turn it on. Yes. It's okay. No, they will see the screen because we're sharing it. So they will just see the screen.
Okay. It's okay right now? Yes? Okay. So, this video is for the 20th anniversary of this 20th anniversary, Smarty, we have manufactured more than near from 75 million aligners with 1.6 million perfect smiles, 91,000 doctors around the world, and more than 7,500 patents. So it's present in more than 57 countries. So it's a very, very, very global brand. Of course, they have all the certifications. It is very important. You know, in Europe, we always have a very exclusive, very important certifications. Treating the same from the FBI for the USA. So we have all the certification from Europe, Australia, United Kingdom, United States, for all the world. Well, and this is the only brand that have a business agreement for the package. Not only for growing nations, it's for adults. So this is very important. This is, for example, the video.
At Smarty, we believe every smile deserves a little magic and a lot of power. Introducing the all-new Smarty GE Aligners packaging, officially licensed by Disney. Now, your orthodontic journey can get a boost of wonder and adventure. When you're ready for a new challenge, Smarty Aligners help you take it on with happiness and confidence. Just like Mickey, who's always ready for new adventures with his optimistic and cheerful smile, Smarty Aligners gives you the confidence to embrace every moment. When you embark on a journey full of love, Smarty Aligners fit seamlessly as your caring travel companion. Just like Iron Man, always be there in his tailored and perfectly fitted suits, loving you more than 2,000 times. Two legends. One incredible choice. New journey, new look. You are your own superhero. Smarty GE Aligners, where magic meets technology.
And this is for adults. So the Disney package normally we think is only for kids in the following questions, but in my experience, the adults love a lot. For example, with Mickey, the Mickey package, they love it. So this of course with Spider-Man or with Frozen, but this is so different. Well, right now, Smarty have 3 manufacturing bases. This one in Xi'an is here from Shanghai. This is an amazing factory. It's new. It's started last year. They have like 100,000 square meters. This is an amazing factory. It's incredible. This second is in Sichuan, in the China's dental valley. And the third one, we are very lucky in Spain because we have a factory since July of the last year. So this factory is produced for Spain and for all the Europe. And the full automatic, smart automatic production line is like this. You see the possibility, the option that the Smarty and the technology is all full automatic manufacturing. So, what kind of products we have with Smarty? Smarty is the brand that has a lot of products different for treat our patients. There are like 5 big groups: GA, Alpha, GS, Teen, and Kinder. What's the difference between? So, the GA normally is like the product that we use around maybe 70% of our cases. So, inside of this package, we have Mini, Light, Express, and Infinity. What's the difference between Smarty for the others? The specification is the software, the Smarty check. They show you after a case to see how it works. The iFast or visualization, this is for example the iFast, is very useful for marketing. So if you want to sell to the patient maybe a visualization of the final treatment in the moment, maybe in 3 or 5 minutes you have. Cephalometry, this is for a year. Pre-refinement results evaluation, Smart Doctor FPD, Life Update. Life Update is a very amazing tool because you can make all the changes and you press the button to click on Life Update and at the moment you have to change. So the idea with a Smarty is if you have a case and you maybe write all your notes, all that you want on your protocols, normally is to approve your case in 50 minutes. It's very important. And the oral health report. This is another special tool. The solutions, they have 20 solutions, different between ACE1, ACE20. And one for me, one of the best different they have with Smarty from the other brands is the medical team. The medical team, they have more than 400 dental designs. So most of them are dental specialists, and most of them are orthodontists. So when you submit a case, you go to Smarty, this case, before I reply to the doctor, this is reviewed by an orthodontist. Every case is reviewed by an orthodontist. This is very important. It's different from the other. And the material is a special material, it's a premium material developed by Smarty. It's not a standard material, and you know some brands, in fact you know Angel and Spark is the same material, it's Tempura, it's not patented, it's like you can buy. But this special material is for Smarty, so it's patented, it's very, very, very interesting. So, in the digital workflow, we have 3D control to move each teeth. We have iFast for the visualization of the final results, like sometimes this is for marketing. We have the life update, it's a making changes at the moment. We have root visualizations. If we don't have the CDCT integrated, it's like not real roots, but we have integrated the CDCT, we have the real roots. So we can see if we're moving these roots outside or inside the bone. So it's very, very important in complex cases. Pre-refinement results, this for example, we have a patient that the patient always is told you, no, I use the liner, yeah, 22 hours per day. Okay, don't worry. What is your aligner? 22, you make the scanner and you can compare with the animation in the 22 and the real position. So we have the different and in which teeth this change. The cephalometric experience. This is a special, for example, if you want to use the EI for this cephalometry. And the oral health report. The oral health report, you submit a case, only you can upload photos and radiography. In 3 minutes, you have an oral health report. This is very useful to see the patient. They have problems with the gums, with recession, with in which the feelings, the caries detected. It's amazing, an amazing tool. The Smarty Doctor, you can download in your smartphone, so you can see the photos, you can see the animation, you can share if you want. And this is the different products. The products in the Smarty we have 4. Mini, Light, Express, and Infinity. Mini for me is for ultralight cases. So, for example, you have a patient that you treated like 5 years before, and you have a little relapse. You want to treat this. So this is for ultralight. Because you have 10 aligners per arch, it's 20 aligners in total, with 1 free refinement, 1 year of expiration, 3 timplet sets. what's 3 template says? You know, all of you use maybe Invisalign. Invisalign has the only one template. It's a very hard template. So normally when you use this template, the attached template, and you need to take out for the posterior area, normally the attachment of the posterior area is coming with your template. So it's complicated. Well, Smarty has like a hard template, a soft template, it's like similar with maybe with the spa. And another different template is the AC template. It's for you have the holes in the template for the acid. And one retainer included. So this is for ultralight. Light package. Light package for me is like amazing because you have 25 aligners per arch, 50 aligners with 2 refinements. So in total 150 aligners. So this is a lot of aligners with 3 years of expiration, the same 3 templates and 1 retainer. This is for, I included light, or maybe Smarty says light, for me it's light and moderate, because with 150 total aligners, we have a lot of aligners. So, the Express, with the Express, you have 40 aligners per arch, 80 aligners with 3 refinements, 8 aligners each one, so in total 320 aligners. Do you know how many cases you can treat with 320 aligners? For me, maybe the 80 or 90% of my cases. So this is an amazing case. This refinement, 3 years of iteration, the same 3 templates and 2 retainers. So it's moderate, and complex. And the last one, the infinity. Infinity is for, of course, infinity aligners, infinity refinements, 6 years of warranty, 6 years. Is 3 templates and 2 retainers. So in this case, you can treat all the cases. Well, this is the acid etching template. So you can see, normally you have in the template there is a hole. In this hole, you use the acid etching. You have to remove. You apply the bonding, and you use the template that you want. Maybe soft, maybe hard, all you want, and you have all of this. So this is an amazing template. It's the only brand that we have this acid template, the only one. And this is a new tool. So since the last month in May, now in the Smarty GE, when you ask, for example, a case when you have eye gear, or maybe you are going to use button, or maybe you are going to use power arm, Smarty send you all the tools, all. So you have eye gear around 0.2 millimeters. You're using, for example, you have the tooth polish screws. If you have, for example, eye gear from 0.5 millimeters, you have the eye gear bar. If you have a buttons, for example, for class 2 or class 3 elastics, you have the buttons. And if you are going to use a mini screw to use the power arm for move the root, you have the power arms included. This one is another tool, another feature different from the others. So this is mini. And this is a model tooth movement in different product series. So you can see mini, of course, it's like not maybe only a ultralight cases, but the difference you can see between Express and Infinity, the only difference is the amount of sagittal movements. Distalization or mesialization. With Express, it's maybe around 3 millimeters, or with Infinity, it's 4 millimeters or more. This is the difference. So, the degrees, the rotation, angulation, this, so this is the same in this package. The another different thing is the liner change. You know, there is always like different opinions, no? So maybe any brand say is need to change every 7 days, another is 10 days, another is 14 days. So each brand has their own protocols. In the Smarty, normally they recommend you change every 10 days. in GA. In alpha, alpha is a package special that have two different aligners. Aligner per day, aligner per night. Per day, for example, is like more hot, and per night is a little more hot. So, normally, they recommend the change every 7 days. In the GAs, it's special for mandibular advancements in adult patients. In adult patients, the first one is to change 10 days, and the first two 7 days. So, this is the protocol for SMART. So, each doctor has a protocol. My protocol is different. So, I told you my protocols. My protocols is, when you have less aligners, normally in each aligner there are more movements. The normal algorithm to move this is normally in each aligner we move 0.25 millimeters like linear, 2 degrees for rotation, and 1 degree for angulation. This is the normal algorithm they use most of the brands. So, if you have, for example, for me, until light package, maybe around 20 aligners or less than 20 aligners, I change the aligners between 14 days. Not 10, 14 days. Between 20 until 30 aligners, 21 until 30 aligners, the change is 10 days. But normally more than 31 aligners is every 7 days. Why? Because we have more aligners, is less movement in each aligner. So, less than 20 aligners, my recommendation, less than 20, 14 days, between 21 until 30, every 10 days, and more than 31 aligners every 7 days. But this is my protocol. This doctor has own protocol. Well, the Smarty Alpha. Smarty Alpha is different because the aligner mini is a treatment with faster tooth movement. It's not faster because they move more than the geological support. No, it's like geological, but normally it's 50% faster. Is for the fibers. For example, I have in one of the clinics, I have my receptionist is using Alpha. When she finished the first package of aligners, like around 22, 24, the first refinement is only 6 aligners. 6 aligners. So it's because I'm very cool with it, to finish perfectly with the torque, with the tips over 6 aligners. So why? Because you're using two different aligners. One maybe around, for example, 8 a.m. until 8 p.m. and another is 8 p.m. until 8 a.m. It's using difference between the significant things. So, the GS. The GS is very, very, very special package. So, it's indicated in which cases. Normally, in adult patients, we have like maybe retrognathous facial, prognathous facial, desviation of mandibular. So we have different solutions. This is developed by Professor Ganchen. He is the best doctor in the world for mandibular advancement or have the knowledge from patients with mandibular problems. We have two kind of different mandibular advancement. In fact, until now, Smarty is the only brand that they have two different devices for mandibular advancement. Like twin block, by blocks in the flussal surface, or by hertz appliance, is with wings in the vocal surface. So it's the only brand they have. We have the S9 mandibular reposition device by occlusal plane anterior, like anatomical or not anatomical, and the S10 is mandibular reposition by occlusal plate. This is indicated for mandibular desviation, or normally you have a patient with a posterior crossbite, very engaged, and you want to correct this. It's very special. And this is the active mandibular position, the S11. This is, for example, for retainer for patients who treated with mandibular advancement. And another package that for me is very, very, very special, because I don't know who is in Vietnam. If you treat a lot of patients, in patients with aligner, maybe, Or not? It's normal to treat growing patients with aligners, or normally it's adults? Adults normally? Yeah. And for example, child, do you treat child with aligners? Yes? Perfect. So this package is very, very amazing because we have two different packages. Smarty Kinder is age between 3 until 10 years, and Smarty Teen between 3 until 60. You know, the name teen is teenager, and you can see 3 years. So I'll explain you later what's the difference between a Smarty Kinder and a Smarty Teen. So, let me show you.
Smarty Kinder and Smarty Teen. First Disney licensed clear aligner products for early orthodontic treatment. Kickstarting a lifetime of beautiful smiles. Fill your patient's smile journeys with enchantment and bravery. Embrace the power of magic in your practice. Smarty Kinder. Specially designed for children to intercept the developing problem. Eliminate the cause and guide healthy growth of dentition. With the love and magic power from the frozen world, guide your young patient's smiles to develop their fullest potential. Smarty Teen. Address malocclusions with dental, functional, and skeletal factors for growing patients. With the amazing power. They're corrected with a confident and fearless smile. It's more than just straightening teeth. It also fosters confidence, love, and responsibility, making the treatment process not only effective, but also fun.
Well, the Smarty Kinder is, let's say the video is for 2 years, for intercepting the problem. Normally it's 2 years of management for primary dentition, early max dentition, and middle max dentition. So, we can correct every problems in occlusal development, any problem. Anterior crossbite, posterior crossbite, side bite, narrow dental arch, ictopia, wherever. So this is an amazing for this disease. This is a very famous Dr. William Brophy. They say the malocclusion is not a disease, but defined as a development variation of the normal occlusion. So, what are the interference during early tooth development? So we have genetic factors, environmental factors, and functional factors. Normally, genetic factors that we have is like our genetic, racial evolution, or individual factors. The environmental factors, we have congenital, acquired, functional, or local disorders. And instead of the functional factors, we have breathing, chewing, sucking, shallowing, and pronounciation. So, for example, if we have a occlusal interference, this is typical. For example, the patient that have like a class 3 malocclusion, maybe functional class 3, and the patient start to this H2H occlusion, and this 2H is going to a class 3 malocclusion. So when you come the mandibular to relationship, this class 3 disappears and appears eye contact. So the patient is not comfortable with this kind of occlusion, so always to bite, they go to class 3. So this is an interference. Or maybe we have like a crowding, making a contact, or maybe a sussor bite. Well, the myofunctional interference, so the patient with problems, different problems. So for example, for the buccal, maybe for the, well, or the full habits, for shocking the fingers, for the joint protrusions, we have different problems. In each one, Smarty have different solution for each one. So, the treatment strategy, in this case with the Smarty Kinder, is prevent and intercept interferences. This is indicate, it's like the first phase. And we have the clear alignment. So with the special things we have for growing patients, the orthodontic force to move movement, the aligner, and features to correct dead poor habits. The myofunctional trainers is the only brand that have myofunctional trainers. It's very indicated for this kind of patients. So silicone products, they address malocclusion biofunctional disorders and apply continuous force for tooth alignment. And the attachment no are normal attachment, are a special attachment for these patients. Because you know normally the temporary teeth they have a small crown. So we need a special attachment. Well, and for example, for clear aligner, we have two different kind of solutions. The integrate solutions and the combinable solutions. The integrate solutions, the solutions in the same aligner. The combinable solutions is solution that you can use with the aligners. In this case, for example, we have tongue protrusion, tongue creep, or the special training protocol. With this SMARTY tongue protrusion, for example, the patient who has a poor tongue habit. So here is a spherical protrusion in the upper alignment to give the tongue in the correct position. It's important, very important, the HT5 sole contact of the complete palatal. Why? Because if you don't have the palatal, it's impossible to manufacture this because the patient is not comfortable. The SMARTY tongue creep, for example, this is a pyramidal protrusion is set on the lower alignment to assist to correct poor tongue habits. For example, the patient that have always the tongue is outside. So this is special. The same, we need to obtain the hard palatal, the 3 to 3 or 4 to 4 in the apparatus. In fact, I always say to my assistants, in growing patients, it's important always to scanner the palatal. Always, in all the patients. It's better that you have this 5 with the palatal, not to, maybe you forget it, the patients go to home and you say, oh no, I need it. Call the patients, come again to our office. So it's important to have always the palatal in the growing patients, in the ST5. And another difference is the training protocol. You know, normally, for example, with Invisalign, Invisalign have only one training protocol, like it's only the classical one. It's the edge of the liners and for the gingival lines. Okay, within the SMARTY, we have a special for kids. You know, these kids normally have a small problems. So a small problem is normally less retention. The retention maybe is problem with the adaptation of the aligner. So, for example, in my case, when I treated the cases with Invisalign first, I put attachment in all the teeth, because we have a very problem with this adaptation. So, in SMARTY is different. I remember one of my first cases with SMARTY, I used the first protocol with Invisalign. Okay, I used attachment in all the teeth, and I used this protocol for a stronger retention. I cannot take out the aligner for the patient. So I need to take out, I need to remove a lot of attachment, this passive attachment that I use, because it's very clean. It's very good. So this is special training protocol that cover the gingival in the posterior area. In the anterior is gingival lines, and the posterior we have more retention. Which is special too, for example. You know, when, for example, in growing patients, the quantity of the expansion is more in normal patients. You know, for example, in my protocols, in adult patients, the expansion is around 2 millimeters in the premolars area, normally. In growing patients, you can also 4 millimeters per quadrant, so it's different. So what's normally the problem when you're using the expansion of the molars or premolars? You always, maybe you saw in your cases, no, with clear aligners, I have always posterior open bite. This is typical, no? You are doing your trimming with aligners and appears a posterior open bite. This posterior open bite, what happens? It's problem with aligners? Yes or not? Maybe both. Because when you do the expansion, normally what's the problem? The problem with the expansion is the expansion is not right here. The expansion is here and the vocal cuspid is gone down. This open bite is wide, this region. So if you're expanding 2 millimeters and you have this problem, you think with 4 millimeters maybe this problem is bigger. So how are you going to avoid this vocal crump down? Maybe using this protocol, because the aligner is extended to the gum, so it's more clear is near from the center of rotation. So maybe the expansion is better. So this one. Instead, you can always, in my cases, normally always maybe a zero torque or maybe extra buccal root torque. This is another thing that you can do. But with this, it's good for this case, for the expansion. Well, and this is the neofunctional trainers, the joy, vitae, the smile. Which is joy. Joy is especially a treatment method used during mixentation. It's to improve the arch, coordinate the relationship of the jaws, give the tooth erosion, and modify the occlusal plane and the occlusal relationship. And instead, assisting malocclusion treatment, including deep bite, deep overjet, cross bite, whatever. This is a very special neofunction. For example, let me show you a clinical case. This patient have the face is asymmetrical, but have the lips are not functional and not closed. They have a maxillary protrusion and side chin muscles. So this is the intraoral scanner. You can see a very excessive overjet with large diastema between the upper incisors, the spacing of the lower central incisors and the rodent of the lower right canine, and a deep overbite. So the lower incisors is touching of the gingiva of the upper arch. This is the radiography, so the lateral symmetry of the condyles, and the cephalometric radiography shows a flat rectangular mandibular body, the protrusion of the upper incisors, and the narrow area. Well, and this is the patient. What happens when the patient is chilling? It's always with the open mouth. The chin muscles are tensing with shallowing, and the abnormal chewing is unable to form a foot bulge. So this is a patient that have not good function. Normally, this case we treat with all the clients. It's complicated. It's complicated. So, with a Smarty, we use only this applier. Only this applier. Not clear aligners, not only this applier, this joyer. It's very useful. The Smarty, normally, this is one of the appliers. The Smarty is like, give you like a present of the first cases, but normally it's with church. But in the first cases, Smarty give you to try. It's very useful. And it's different size, because you know, it's different movement between 1 until with 3 years is different from 12 years. So different size, like S, M, L, XL. So in this case, you need to, of course, to use the indicated size for the patient, and you can see after 3 months of treatment how it reduces the overbite. It's evident. We're going to look the diastema of the anterior teeth here. You can see the difference. And the spaces of the upper arch is getting smaller. Now, for example, the upper incisors now is not touching the gingiva, and the overjet has decreased 7 millimeters. We only using this function. This is the patient, the follow-up after 1 year. So your facial muscle now are more relaxed. We have a normal lip position. This is the situation. Of course, it's not perfect because we use only neofunctional. Of course, the midline is not centered. Okay, it's true. But the important thing is we have developed the upper arch, we developed the lower arch, we reduce the overjet, the overbite, and of course the functional. You can see here all the patients now can close naturally when it's chewing. The shallowing has improved, the chin muscles, you can see the chin muscles now are more relaxed, and now can form the four bones. It's not opening the mouth, it is. Only using a myofunctional trainer. You can see the different. You can see the level of the arch, the upper, the lower, and the fascia. This is an amazing. I love to treat patients with early dentition because if you correct the problem with this joint, you avoid the problems for the old patient. The other neofunctional trainer, the Viti. The Viti is 3-in-1 appliance because it's for labial muscle training, the patient using for press with the labial for the labial muscles, with the tongue muscle training. This, for example, that patients that have a frenectomy for training the tongue, and the masseter muscle training is biting the appliance with the teeth. 3 different in one appliance. And the smiley. Smiley is like assisting correcting for habits, including the breathing or the lip or finger shaking, because you can use at night. It's like oral screen, classical oral screen, but modified, and he improved his deficiency in labial muscle function. So the patient put between teeth and lip, close, and they put it out quickly by hand with external force. So it's indicated using at the day, normally between 2 or 3 hours per day, and using all the night, if it's possible, because sometimes the patient at night may need this appliance as well. But normally we use for 2-3 hours, and if it's possible, all the night. And this is the optimized attach for teeth. So the crown is smaller, so we need a smaller attachment. This attachment is 40% smaller with the cavities. And we have different attachments, not the classical attachment. We have classical attachment, on this have like optimized attachment, special for these patients. This is the correction plan. I'm going to count this. And this is the indication. It's for all the indication, all the problems, all have. The only not indication for asthmatic kinder is we have problem of skeletal and sagittal problems. Is for example for mandibular advancement. For mandibular advancement, it's indicated thin package. For the rest, you can see later between kinder and thin is the same. You can do the same. So the only difference is sagittal problems. You can see, for example, for mandibular advancement, it's better using thin package. So this is the difference, and we have here aligners. Depend, but it's limited. You have all that you need. It's limited. The joy normally is 2 pieces. This joy normally is an extra cost, but in the first cases, Smarty give you to use and to try. The Viti and the Smiley always is included in the package. Always, in all your cases. Maybe this case need your Smiley or your Viti you can use, but if you don't want or you don't need to use, maybe I have a box with all my Viti, and sometimes maybe it's coming patient from maybe you don't need to use the liner, but you can use this one. You can use this one for other patients. Or maybe you have a patient using braces and you can use this appliance. You can use. So, the aligner case, the special packets. If you ask, for example, for Disney packet, you have very beautiful box with Frozen, with Spider-Man, the special. This is all is included. It's included the chimney. You know the chimneys to bite the aligners, to insert the aligners. It's included too. The lanyard and the package is level. All of this is included in your package. Let me show you another clinical case. For example, it's a female with 8.5 years. So, deep eye, deep overjet, arch narrowing, the tissue narrowing, and we lost the 83, and we lost all the space for the 53, the canal. This is the pre-treatment radiography and teleradiography. And what's the treatment plan in this case? So, in this case, and we're going to use the smart tone protrusion and the smart tone creep. You can use both. In fact, the good that have Smarty, you have maybe 20 solutions, and sometimes maybe not all the solutions are the same in the same patient, but you can use different solutions. So in this case, we're used to use this is the treatment plan. You can see here. In the Smarty check, it's like looks like the tongue protrusion, and this is looks like the tongue creep. So we are going to expanding both ears with the pontic here. You can see the expansion. In this case, in this protocol, is symmetrical expansion. You know, are different protocols. You have, for example, molar first. Do you know the protocol molar first? Do you use any time protocol molar first? No? Okay. Normally this symmetrical expansion. When you want, for example, the expansion from the same time both. The molar first is, for example, if you want to make more predictable the expansion, the molar first is you start only move the first permanent molar until the final position, when this first molar is in the final position, you start to move all the deciduous teeth. So another different protocol is incisor first. Incisor first is indicated, for example, in cases with class 3. Typical patient with classic malocclusion, H2H or anterior crossbite. You need to improve the first one to improve this anterior crossbite. The incisor first is you don't move the posterior area and you start only move the anterior area. This is especially in class 3 malocclusion. It's very good protocol for this case. So the first unit is incisor first, and when you correct the anterior crossbite, you start to correct the posterior area with expansion. So it's different protocols in child. So in this case, we use the symmetrical expansion protocol. And you can see the attachments. So, for example, if I treat this case with Invisalign, is attachment in all the teeth. The other important thing in these cases is, for example, the overcorrection. The overcorrection, what is it? For example, this patient has overbite, increased overbite? Yes, of course. So if we have increased overbite, normally I finish in my Smarty check with, in the anterior area, like not open bite, but near from open bite. But in the posterior area, is a very hard contact, very important. So sometimes we want to show a very beautiful Smarty check or very beautiful, like in Visa is the same. So how is beautiful? Sometimes the beautiful is not good. Sometimes you need to see a very not bad, but maybe different. Why? Because here, for example, if you want to correct this overbite, it's important you can see the fusion of the molars. So this is the extrusion. This is the overcorrection. In the Smarty check, you need to show like the very, very hard contact. In red color, maybe in blue color, very hard. This is the overcorrection for the overbite. So this is in aligner number 5. You can see here, open the space. This is the aligner number 9. And this is the first refinement. You can see, again, extrusion, hard posterior contact, anterior, near, not open bite, by maybe 1 millimeter, 1.5 millimeters of overbite. And we continue with expansion. We continue to use the tongue creep and the tongue protrusion. See here, the tongue protrusion, the tongue creep. This is the aligner number 6 in the first refinement. The aligner 15. And the aligner 21. So we are correcting all the problems. And this is the post-treatment with the space open. Okay. So in these cases, for example, who treated with the old appliance, maybe using a quad helix, maybe using a disjunction, maybe a lingual arch. For me, it's complicated. I use a lot. I'm in love with Quadelix. Quadelix for me is one of the best appliances that they use. But since 8 years ago, I don't put anymore. I only use clear aligners for my growing patients. All my growing patients are treated with clear aligners in the first phase, in these cases, to intercept. Okay? To correct, it's true that sometimes the parent is saying, no, I don't believe that my child maybe is confident with the appliance. Okay, doesn't matter. You will braces, but normally, I prefer always, in interest, always, I use clear aligners. It's the best way to treat. If with a Smarty, you have a lot of solution to treat these patients. This is the posterior radiography. Now we have the space for the canine. Another clinical case. Female, 7.2 years old, with lots of space for the lateral incisors in the upper and the lower arch. Preclinical radiography. And what's the treatment line in this case? In this case, we're going to the joint protrusion. So this is the Smarty check. You can see here the same. You have an overcorrection in this case. Another thing very important for me in my protocols, if I can, I always leave at least 0.3, 0.5 millimeters for mesial and distal from the serious canine, normally, because you need more space for the change of distal. It's very important. So this is the first refinement. In the refinement, you can see space here. Now, for example, the posterior area, we don't move the posterior area, and we only move the anterior. Canine to canine. In the same way in the lower arm. So this is the post-treatment. So we have this case prepared for a second. It's important always to explain to the parents, because sometimes, I don't know who's in Vietnam, but in Spain, you know, always the parents look at you. So, doctor, instead with this treatment, my son have the perfect smile, and then maybe she doesn't need another treatment. I don't know why, because sometimes you need to change 12 teeth. So maybe this canine, the erosion is very good, or maybe the erosion is with rotation. I don't know. So with this treatment, it's important because we are going to avoid a complex case at the future. So in this moment, actually, this case, I do the best my way to have a very good result. And if all the teeth, when they change all the teeth, maybe are in a good position, maybe it doesn't need, or maybe will not need a second phase. But I don't know. This is important because some parents, they say, oh, doctor, you tell me with this, my child has a very perfect smile, in the first phase, intercept phase, knowing for all. It's the same, no? People think that this treatment is for all the life. I think for all the life is nothing. So this is special. Well, the pre-treatment and the post-treatment. Well, the Smarty team. In the Smarty team, we have 5 years management, between 3 until 16 years. Is for all dentition, of course, primary, maxim, or early dentition, or the permanent dentition. The dental problems are the same, so the difference is we can treat the facial problem, the class 2 malocclusion, with, in this case, mandibular aplasty. It's the same, prevent and intercept interference, like the Smarty Kinder, so now we can give and correct the malocclusion to make harmony, stable, and aesthetic results. It's the same, we can use clear aligner, myofunctional trainer, This functional appliance is because Smarty has functional appliance like classic functional appliance like expansions or maybe with the pallet bar or maybe with the maintainer. So, for example, I don't use this one, but you have, if you want to use, you have the option. So, the same, don't production, don't read, the same aligner timing protocol. You can use that you want. For example, you say, okay, maybe I want to use the classical only cover the gun, perfect, or low cover the gun, sorry, but I want to cover the posterior area. You can try everything you want. And we have different 5 solutions, ACE 8, 9, 10, 11, and 16. This 3 first is for repositioning mandibular, S11 is for transversal problem, and S16 is for flastering. The Smarty hook and the Smarty bottom. The same. Smarty is the only brand that we can try if we want to use Smarty bottom or Smarty hook. So different. I'll explain you after. So this is the same. The same. Very important. 20 hours per day. It's true. I don't know how is the patient doing now, but in Spain you need to say to the patient you need to use 22 hours per day. Don't worry, the patient use 18 hours or 16 hours. But if you say no, don't worry, use 16 hours, maybe use at night. If you say use at night, they don't use. So it's important 22 hours. It's true. In growing patients, normally the effective is better. Using less hours. For example, I have some patients who say, oh, my child is very, I don't feel it's comfortable using the liner at the school. Maybe if impossible not to use at the school, okay, it's possible. So, if he's using less hours, we need to change more days. So for example, in my protocols, if I say use 10 days or 7 days, if this patient is using not at the school, so maybe like 16 hours per day, okay, please change the protocols. No change every 7 days. 7 days, we change to 10 days. 10 days, we change to 14 days. So it doesn't matter, no problem. In fact, in growing patients, the fit is better than in adult patients. Well, this is another amazing solution, the lip bumper. The lip bumper is, for me, is one of the best solutions. But it's indicated, or maybe the functional is different. So, how many here do use the traditional lip bumper, the traditional one? How many are using the traditional lip bumper? Only me, the traditional? Okay. When you use the lip bumper appliance, in which cases? The traditional.
Look at this, they lost the tension of lip also. So we need to do a lip bumper to prevent this.
Yeah, of course. The traditional lip bumper, normally we have a very hard inferior bumper as a lip, and in this case it is to avoid the force of the lip, and it's for the pro-inclination. Or in some cases, for example, when I started my postgraduate program 23 years ago, I used a lot of lip bumper in extraction cases. It's to the bumper make force, and it's to avoid the movement of mesial of the molars. So, in a Smarty, it's just the opposite. We use the lip bumper to avoid the pro-inclination of the incisors, because the lip bumper is an extension of the aligners, and we can use in the lower or in the upper arch. It doesn't matter. So if we want to avoid the pro-inclination of the lower incisors, you can use the S2 solution. If we want to avoid the pro-inclination of the upper incisors, or if you want, for example, you optimize the anchorage. So for example, in my cases, in all my cases, when mandibular advancement, what is the one of the not visible problems with the mandibular advancement? What happened with the lower incisor in mandibular advancement? The pro-inclination. It's typical. It doesn't matter what kind of appliance, bionator, twin block, Frankel, clamp, aligners, wherever. Always the evaluating structure is pro-inclination. So we want to avoid this pro-inclination. So we use lip bumper in cases in mandibular bump. This solution is free. What you can use is you don't pay nothing for this solution. So maybe you can use in all cases that you need it. For me, for example, in mandibular advancement, I always use an inferior lip bumper, but you can use in the upper. Clinical case, for example, this patient with growing arch, growing in the upper arch, growing in the lower arch. So in this case, we're going to use the lip bumper in the inferior arch to avoid the pro-inclination and the clinical function. The mandibular repositioning device, we have three different. Mandibular advancement with two devices, twin block and hertz. The S9 back plane, anterior back plane. This is indicated, for example, with patients with dysfunction of the TMG, and we have with increased overbite. And the S10 occlusal spleen. This is very useful in patients with mandibular desviation. You know, normally when we have a patient with a unilateral crossbite, this patient have the mandibular desviation for the crossbite side. So if you want to correct this posterior crossbite, this is very indicated because you have, using the liner, is a disocclusion of the posterior area, and to correct this crossbite is better. So, and you can use this, for example, in cases with this mandibular desviation. It's like a occlusal spleen. You can use here, and the mandibular is going to the right position. Well, the mandibular reposition with the mandibular advancement, we have two differences. Twin block and hertz, which indicated each one. So the twin block normally is indicated, the summary is when we have deep overbite, but we normally have an increase through spin, it's indicated twin block appliers. When we have flat through spin and we don't have overbite, we indicate hertz appliers. This is the summary. This is about the difference. Inside we show you classification of the Professor Ganchen. It's an amazing classification, but the summary from making it very easy is deep overbite and increase through spin, twin block. Normal overbite, flat through spin, hertz. This is the difference between each one. This is the block in the occlusal surface, and this is the wings in the buccal surface of the posterior teeth. With the mandibular advancement, we have a lot of particles. The classical one from puncture with the hairs, with the twin block appliance, with clag, the bionator, maybe comparing with the patients with classical appliance like this one, twin block, hairs, bionator, Frankel, clamp, wherever, with the mandibular advancement. So, Professor Rensier has a special book with this QR you can just scan, and you have to download this book. It's edited by Smarty, and you have not all the articles because the professor have a lot of articles, but maybe the most important published between 1991 and 2021. You want to read. This is very special because this is the first cases with the professor in the University of Sydney in rats, with the mandibular, of how we change the content, the position, the remodeling, the content. So this is very, very, very amazing. And we're very late because we have the professor in my city, in Valencia. This is the University of Valencia, and this is with the professor in Valencia, in Plus. It's a theoretical and practical course, very amazing, with Dr. Lu, another amazing doctor, another amazing person. So, and we are staying in China, like in October, maybe, Gary? October? I think so. So, you know, in China, when the professor goes to Smarty, give a lecture every 1 week, 2 weeks, every week, in different sides of China. Well, you know, in Spain, for example, the next week we have our annual meeting from the Spanish Society of Orthodontics. Normally, it's like 700, 800 people there. So with a Smarty, every week that they do a course, it's around 1,000 doctors. It's crazy. In fact, I have 2 times in China. This is Chengdu. The first one is in Shenzhen. It's like 1,200 doctors. It's amazing. So this is with the colleagues from the Saudi Arabia. Stayed with them 1 month ago. And this is in the office of the professor. It's a very beautiful office in the center of Shanghai with 3 floors, 80 chairs. It's more chairs than my university, so it's crazy. This is an amazing, and the team that has the professor is very good team, like professional and personal team is amazing. So the doctor do a classification from different mandibular position. Maybe grouped by physiological mandibular retrusion is dental-alveolar mandibular position, or mandibular polygyny 1 or polygyny 2. Which is the difference? This is class 2 division 1. This is class 2 division 0, maybe. It's with the anterior teeth with a straight anterior teeth. And this is class 2 division 2. Okay? This is the classical class 2 malocclusion. Why? But we have another. This is pathological mandibular retrusion. But this is, for me, it's more complicated cases. Why?
Yeah.
Because the profile is class 2 skeletal, but dental normally is class 1. So it's complicated cases because if you want to improve the profile, you are going to move the teeth in the incorrect position. But if you want to correct the here, you have a very good occlusion in class 1, but you have class 2. So it's more complicated cases. With Smarty, we can treat every case. This is the diagnosis classification. You can see this is an amazing classification from the professor. You have the clinical manifestation, mandibular morphology, pathological mechanisms, treating protocols. So we have all. But to make you very easy, to make the summary, is the same I repeat before. If you have increased overbite, the 3 Ds. The professor said the 3 Ds. Increase overbite, increase overjet, increase cure speed. So this is the 3 Ds. It's true that normally the overjet, it doesn't matter. Because you can treat the class 2 malocclusion, it's class 2 division 1, it's increase the overjet. In class 2 division 0, it's a little increase, but in class 2 division 2, it's not increase. It's decrease, because normally it's a contact. So you can use every appliance. In this case, with 3 Ds, you can see twin block. If we don't have 3 Ds, the HP, the hex appliance. And this is the wax registration for mandibular reposition. What is this? For example, if you have class 2 division 1 malocclusion, we have an increase over here. Yes? Okay. So, how are they lower the upper incisor? Are pointing it. So, if normally in another branch, for example with Invisalign, when you ask, for example, with I want 2 mandibular advancement, Invisalign is telling, okay, what do you want? H to H, or maybe 1 millimeter with anterior crossbite or 2, but it's not real. Because if you have a class 2 division 1, you need to think that when you move mandibular forward, you need this upper incisor to retroncline. So you need at least 2 millimeters of overbite in your wax registration. Why? Because you need to retroncline these incisors. So this is very important because if you ask H2H malocclusion in class 2 division 1, when you start to retroncline the incisor, you are going to create anterior crossbite. So it's important to make the mandibular forward 2 millimeters of overjet to retroncline the incisor. But if you have class 2 division 0, normally this is H to H because the anterior teeth are straight. So in this case, it's H to H occlusion. Perfect. But what happens when you have class 2 division 2 malocclusion? How are the upper incisors? Retroncline. So if I ask, for example, H2H malocclusion, when I start to move this upper incisor forward, I create an overjet. So in these cases, I need to think, okay, at the final, I want to maybe 1 millimeter overjet. So if I need to pro-incline this incisor, in my wax registration, I want a 1 millimeter for a very close line. But thinking at the future, but I want to pro-incline this incisor. So it's different. The wax registration is different in each case. Class 2 division 1, class 2 division 0, class 2 division 2. This is very important. This is the two different appliances, the TV and the EC. So let me show you, this is one of my favorite cases that I had. This is Alba, this is 16-year-old. This patient was treated before, around maybe 3 or 4 years before with a traditional appliance, and you can see the smile, the teeth are very straight. It's like this. They have a problem in the profile. They have a P-reduction profile. So when the patient is coming, you see, okay, if you see only the upper arch and the lower arch, you can see, okay, maybe it's no problem because it's very straight teeth. The form of the arch is very beautiful. So what's the problem? The sagittal position of the mandibula. This is the problem. So maybe the colleague that was treating this patient, they think only to make a straight alignment the teeth is enough, but we have a problem in the position of the mandibula. So in this case, for example, we can see class 2, near from class 2, complete class 2 division of the right side, class 2 complete division of the left side, class 2 canine, class 2 molar, midline center is okay. So this is the orthopantomography. She has agenesia of the lower third molars. We have the upper third molars. In this case, I recommend to extract, but the patient doesn't want to extract the third molars. For my treatment, it doesn't matter, no problem. So in the future, it's true it's important to extract because knowing the extrusion of the upper third molar is maybe we have a problem. This is the lateral radiography with the cephalometry, and you can see the upper incisor is a little pro-inclination with the class 2. And you can see this important tissue, the TMGs. Which are the TMGs? Where are the TMGs at the beginning of the treatment? You think they are in an ideal position, the TMGs? No, they are outside of the glenoid fossa. They are outside. So this patient have a problem with the TMG. Maybe with this age, with 16 years old, this is no problem. With 16 years old, it's no problem. You are very happy. But when this patient is growing, they have a problem with TMG. So in this case, what's the treatment plan? When coming back. Okay, in this case, what's the treatment plan? What do you think? We have to use class 2 malocclusion, class 2 division 0, class 2 division 1. Of course? Yes? All right? Well, we have increased overbite. Increase overbite? Yes or not? Have overbite? No? Yes? Not overbite. It's normal. We have increased cure speed. No, cure speed is increased. So, which appliance is better? Twin block or Hertz? Hertz appliance. So in this case, the treatment plan is Hertz. This is the patient with the wax registration. So, you know, I think all of you are using a scanner. You have on your office a scanner, intraoral scanner, maybe. If you don't have, you need one, because with the scanner, change your life. So, in fact, Smarty have one of the best scanners. In my office, I have my Itero 5D Plus, Super, Ultra, whatever, and I have my Aristar. this is it's better that you start that Invisalign. But the problem with Invisalign, if you need to add iTero to use Invisalign, because the other scanner doesn't work. With a Smarty, you can use all the scanners that you want. All the scanners, you have one scanner, any brand, that's perfect. The iTero. But normally you don't have, please, it's important to have an scanner. It's not the future, it's the present. It's like the CBCT. CBCT is the same. So, in this case, you cannot see here, but the patient is here with the back, with the wax. But the wax is not appearing in the scanner, because you start scanning the lower arch, the upper arch, and when you use the wax and you put the mandibular in the right position that you want, in this case, near H to H, I have like that, maybe around 1 millimeter, because I need to retroincline this incisor. You use the wax, you need to remove the wax for the buccal surface when the scanner, this is with the wax registration. So I can see here, maybe I have near from class 2 malocclusion. I know in the right side I have my class 1 molar malocclusion, but in the canine is a class 2 malocclusion. So this is my Smarty check. So what's the problem with this patient? This patient has the class 2 malocclusion problem, but has another problem. It's the tongue habit. The patient, you are talking with the patient, is talking with you. So in this case, I use the ACE solution with mandibular bathment with herb appliance. I use the lip bumper. You can see here the lip bumper to avoid the pro-inclination. And I use the K3 tongue grip for the tongue. So all the solutions only in one appliance. This is amazing. This is amazing. In fact, you can see normally in the Smarty team, right? You can see here the different numbers of the here. The first 6 aligners is not movement. It's only to the patient to be comfortable for the change of the muscles. So the first 6 you can see is only passive aligners to the adaptation for the patient. After this, you can see. And another thing is very important, and the professor always speak and say the same. With another brands, like Invisalign, for example, is you can correct the class 2 millimeters instead 2 millimeters instead 2 millimeters between 8 aligners. So in traditional appliance, in twin block, Bionactor, clamp, wherever, we correct these 2 millimeters, or we correct only in one step. Always in one step. What is 2 millimeters? So the professor always say this it doesn't sense. Why? Because the idea for the remodeling of the condyle is in one step. Because you need to move the mandibular forward in the right position from the condyle remodeling. So important in one step. No 2 millimeters, 2 millimeters, 2 millimeters. At the beginning, when I use Invisalign or mandibular abutment, I use this protocol that Invisalign recommend. It's 2 millimeters, it's 8 aligners. So my cases, it doesn't work, or not good. So I changed to the traditional. Okay, give me only one movement. But for example, with Invisalign, you need at least 26 aligners for this movement. It doesn't matter, it's 2 millimeters for step with 8 aligners, or only in one step. It's at least 26 aligners. But the other problem with Invisalign is you cannot move the teeth are under the precision wings. With Smarty, you can see we're moving all the teeth at the same time. You are moving the mandibular forward and you are moving the teeth at the same time. With Invisalign, it's not possible. It's not possible. So this is different. And this is only one step. What? This is the patient with aligner 18. We have the aligner with the wings, with the lip bumper to avoid the pro-inclination, and the tongue grip for the tongue habit. This is like, we are here. We're near from the class 1 molar. Here is incomplete class 2 molar. And this is the scanner in the liner 18. The orthopantomography, the telegraphy. Now you can see the upper incisor now is more retroinclinate. And this is the patient 3 months ago in the liner 40 before the first refinement. You can see here. We have class 3 molar, class 1 canine. Here is class 1 molar, still class 2 canine. But what's the problem here? The problem here is this mandibular advancement is really good, and I have anterior contact, so I don't have overhead. I lose my overhead, so maybe I need to correct for this my line desviation. So maybe instead I do IPR in the anterior area. So maybe I need more IPR for retroinclination of the lower incisor, because I need to a little more advancement of the left side to correct this class 2 in the left side and to correct this deviation of midline. This is the orthopantomography, this is the telegraphy, and this is the chains. So, the comparison between radiography, facial, and dental, you can see, for example, in orthopantomography, maybe it's not a lot of chains, but you can see the difference in the telegraphy. This is very, very different for the pro-inclination and the mandibular position. So, in the BTO, you can see here, we do a retroinclination of the upper incisor with mandibular forward. We correct this class 2 to class 1, and the upper incisor, the lower incisor is not pro-inclinate. We avoid this pro-inclination with the S2 solution with the lip partner. And you can see here the morphing of the change of the position of the mandible. But what's the most important change? For me, two. The first one, the profile. The profile right now is very beautiful profile. It's no big retouching profile. But the other important change for me is this one. The TMG. You can see here the TMG is outside the glandule fossa. Right now, it's inside the glandule fossa. So it's in correct position. And of course, we have remodeling of the condyle. It's true that the professor will say that normally we need at least 12 months to see change, but this is no growing patient, because normally a girl with 16 years is an adult patient, it's like the same. So you can see the remodeling of the bone and the position of the condyle inside the glandule fossa. This is amazing. This is amazing. So this is not magic. This is science behind. The professor has a lot of articles, and one of these is the biology of the TMG growth modification. You can see here a patient treated by the professor. So at the start of the treatment, and 12 months later, you can see the remodeling of the bone. All of this is remodeling bone. This is amazing. So this is biological. This is not medical. And we can do this in growing patients and in adult patients too. This is very important. The Smarty is the only brand that have a special mandibular advancement in adults. I know it's complicated to understand. For me, when I meet Smarty, I went to start to say, no, we have for adult patients. Adult patients, mandibular reposition, adult patients, they don't have growth. It's possible. I start my patients, and it's amazing the results. Of course, it's very important the compliance of the patient. So, these two books, I don't know if you read two books. For me, this is very important, because in my first year, my mentor, they say, okay, I'm going to do, it was in July, they say, in September, exam from these books. So if you don't pass these exams, you go out of the postgraduate. So we are very lucky, we all pass this exam. So in this you have the fascial growth, the sexual fascial growth, and the fascial growth. So, another case, for example, in this case, class 2 malocclusion, complete class 2 malocclusion, bilateral. So, In this case, we have increased overbite. Yes. We have increased curve speed. Yes. So it's indicated hertz or twin block. Twin block, of course. So this is with the wax registration. When you can see this ST5, my assistant tell me, Dr. Vicente, I think you have a mistake in the wax registration because all the mouth is open, but normally you may be any contact. No, this is good wax registration. Why? Because the professor always say in the posterior area, if you want to correct in patients with increased overbite or increased curve speed, you need at least 4 millimeters or 5 millimeters from posterior open bite, because you need to make the extrusion of the posterior area and the intrusion of the incisors. If you here use like 2 millimeters, or maybe if I was registration, in this case is like H to H, or maybe it's class 2 division 2, maybe 1 millimeter of crossbite. If I make the wax registration with this H touching the H, here I don't have 4 millimeters, maybe 2 millimeters. When I send this ST5, the technicians tell me, doctor, this is not good. You need at least 4 millimeters. So you need to do it again. So it's important always 4 or 5 millimeters. In this case, this is the professor always saying. Vertically important at least 4 millimeters. In fact, the professor changed this for now it's 5 millimeters. The recommendation is 5 millimeters. This is very important because if you don't have these 5 millimeters, it's impossible to correct. So the smarty check of this case, for example, we start at the beginning. However, I want to avoid the pro-inclination of the lower incisor, so I ask always my S2 solution, my lip bumper. The next, I have the blocks in the closal surface, the twin blocks. And you can see another thing important is we are moving all the teeth, but we are doing the distalization of the upper arch. Distalization at the same time as mandibular forward. This is crazy. And I don't use elastics. Why I don't use elastics? Do you think I need elastic in this case? I don't need elastic. Why? Because in the, give me 1 second, the blocks, these blocks, the upper block and the lower block, if I do distalization from the third law of the Newton, if you have a force, you have the same force in the opposite. So in this case, if I have this distalization, I have a force to move this forward, but the blocks, the position of the blocks give me the retention, give me to avoid this third law. So I don't need to use these blocks give me. So in fact, I want these blocks because the distalization is to move this forward, but this force applied to the blocks and move the mandibular forward. So it's perfect. It's perfect. It's true in some cases, that for example, you have the lower incisors pro-inclinated, it's true that the technician tell you, doctor, we recommend you to use a mini screw, buccal cell, and use an elastic, class 3 elastic, to maybe directly to the aligner, in the cut aligner, or maybe in the smarty button to retroincline. Because if you have the incisor in pro-incline and you're going to correct the class 2, maybe you have anterior contact and you cannot correct exactly or perfectly this malocclusion. So, but the technician always asks you, doctor, you need this one. And you try if you want or not. But in some cases, I have in my smarty check, I don't ask, and the technician send me, okay, doctor, we recommend you to use here a smarty button, and buccal cell mini screw to retroincline. Oh, thank you very much. So, this is another mandibular reposition device, the S9 biplane. This is to create a vertical space for deep overbite and stabilize the mandibular position. And the occlusal spleen is for mandibular desviation and facial retrograde case. This is the biplane. This is a clinical case, for example. You see here the non-anatomical biplane. This contact here. So with this contact, we can intrude the lower incisor and do this disocclusion of the posterior area to extrude the posterior teeth. And the occlusal spleen. So in this case, for example, you can see you're doing the distalization. In this case, for example, yes, in this case, we're using mini screw for the distalization of the upper arch. But this occlusal spleen, you have the option to make the disocclusion, and you can see we have a midline desviation, so we can use to center the midline and correct the problem. Another clinical case. This is the wax registration. Very important to have the posterior disocclusion, center the midline. In this case, you can see little desviation, the wax rotation to center, and we have the final results. So we have a lot of different solutions to treat our patients. Another special device, the palatal device. Now it's like very new future. No, we have Invisalign. No, we have a palatal expander. Oh, it's new future. New future. Palatal expander is like the disjunction, but in growing patients. But this palatal expander, for me, for my patients, I don't use. I will never use this palatal expander. Why? Which is the best disjunction of the world? Which is the best applier that we have in the mouth? The tongue. The tongue is the best important. So if you put the tongue in the correct position in the upper arch, they will expansion. So this device, S11, Smarty has this device, so 2019. And this device is in the same aligner, is not touching the palatal, but the patient can put their tongue in the upper arch. So it's very comfortable for the patient. So you can use the clear arch expander. If you are using the anterior area, is for expansion. If you use the same but in the posterior area, is for anchorage, for retroinclined incisors, or the nance bottle. The typical nance bottle that we use, for example, in case of extractions, you can use for anchorage. But it's the same. You can use the clear nance. You have the anchorage in teeth and in the soft tissue, and you use for the distalization. And you combine. In one case, for example, you can just start using the clear nance for the distalization, and when you finish the distalization, you use the clear transpalatal bar, and you start to retrograde. It's amazing. This is how it works. The S11 solution in the anterior area for the expansion. Yes, integrated in the aligner. Another solution, the S15, the integrated traction device. Two differences. The Smarty hook, the Smarty bottom. What's the difference? The Smarty hook is in the same position of the teeth, but it is not compatible with attachment. It's only on the teeth. If you come to use attachment, it's not possible in the buccal surface. You can use the Smarty hook in buccal surface and use an attachment in lingual surface. The Smarty bottom is not bonded, it's integrated. This is very different because, for example, I use angel aligner. Angel aligner was coming to Spain is, no, we have the angel bottom, amazing angel bottom. Angel bottom, it broke a lot because it's bonded. It's bonded on the aligner. The Smarty bottom is integrated in the aligner. It's different. And for example, this device, indicating class 3 malocclusion. The S16 is the combination of the S11 and S15. You can see here a Smarty button for the facial mask, and inside we have the S11. So this is to have, for example, if you treat cases with you need a classroom occlusion with disjunction, you use the facial mask with elastic. The traditional is with disjunction. So I don't use normally in all cases, but I don't use a disjunction. I use a Smarty. With a Smarty, I have my expansion, I have my S11 to coordinate, and I have my Smarty button for the facial mask. Hmm? Yeah. That it works. Yeah?
I have to place every every system to entering to hit the
Yeah. Yes. Yeah, in the attachment. Yes.
my son. My son.
Your son.
Yeah.
Okay. So we finish with this clinical case. We finish the first part, or
Let's have a little break.
a little break
Yeah.
right now, or
Yeah, maybe now so people can,
perfect.
do some
Perfect.
stretching.
Perfect. Take first. Okay, let's go. When we finish here, we start again.
Chúng ta có tea break ở phía dưới cà phê. Các bác sĩ đi lại chút cho đỡ buồn. Sketching một chút.
Sorry. I want to ask one
Yes.
question before you pass the slide. Can you back to the case that you said that complex?
Yeah.
The skeletal class 2, but this class 1. How much is class 1?
The previous case.
Yeah, the thing you said is very complex.
Yes, of course. In these cases, normally is you can to move the mandibular forward, but you need to the teeth to move back. So in these cases, normally you need a mandibular advancement, so a buccal cell, mini screws, and distalization of the lower arch. It's complicated because if you need to
Because I saw you extract all the
extractions
first corner.
with extraction teeth.
The case with the by protrusion.
Yeah, when you have a big protrusion, in these cases, you need to mandibular advancement, but you have to improve the profile, but you need to the distalization of the lower. So in this case, normally you need the AH solution, mandibular advancement, but how you are in class 1, maybe you create anterior crossbite. So to avoid this, you need to mini screws and distal of the lowers. I think it's complicated to understand how
You
in
change the occlusal then?
yes. Yes. So you need, in some cases, you need to mandibular advancement and distalization of the lower arch. It's complicated, normal distalization in class 3. So in these cases, if you want to improve, in some cases, it's true that you need to understand the patient, but sometimes it's not always possible. So you need to try. You need to make a very good profile in this case, or maybe you want to establish this occlusion and this profile. So you need to try. But sometimes if you want to all, is mandibular advancement and distalization of the teeth. No, you're welcome. Yes? Okay, let's go.
Chắc khoảng 20 phút nửa tháng